Movements of the shoulder girdle is retraction, protraction, abduction, adduction. The origin of the deltoid is the lateral first thirds of the clavicle, and the insertion is the um, deltoid tuberosity of the humerus. The teres major origin is the lower part of the lateral border of the scapula to the medial lip of the humerus. The latissimus dorsi has a large area of the origin between the T7 vertebrae up to the third rib. The floor of the intertubercular groove of the humerus is the incision point for the latissimus dorsi. The pectoralis major muscle has three different origin points or parts to it: the clavicle part, the sternocostal part, and the abdominal part. The clavicle part consists of the anterior surface of the medial half of clavicle. The sternocostal part consists of the anterior surface of the sternum, the costal cartilages of ribs 1 through 6. The abdominal part is the anterior layer of the rectus sheath. The insertion point is the crest of the tubercular humerus. The origin of the supraspinatus is the fossa of the scapula, which is on the back side here. And the insertion point is the greater tubercle of the humerus. The infraspitus origin is the fossa of the scapula. Is the infraspinous fossa of the scapula, and its insertion is the greater tubercle of the humerus. The teres minor origin is the lateral border of the scapula, and its insertion is the greater tubercle of the humerus. The scapulopolaris origin is the subscapular fossa of the scapula, and its insertion is the lesser tubercle of the humerus. The origin of the supinator has a very broad origin between the ulna and the humerus. Its insertion is the lateral edge of the radial tuberosity and oblique line. The triceps brachii have a origin of the posterior side of the humerus and scapula, and its insertion is the ulna. The origin of the MKS is lateral epicondyle of the humerus, and its insertion is the lateral surface of the olecranon. The biceps brachii has an origin on the scapula and the insertion on the radius. The brachioradialis has an origin that is lateral to the ridge of the humerus and an insertion of the radius. The brachialis has an origin that is the distal half of the anterior surface of the humerus and an insertion of the cornid process of the ulna. The pronator teres has an origin of the medial supracondylar ridge of the humerus and the ulna head. Its insertion is the lateral surface of the radius. The pronator quadratus has a distal anterior surface of the ulna, and its insertion is the distal anterior surface of the radius. Movements of the wrist is wrist flexion, wrist extension, wrist abduction, and adduction. Flexion and extension takes place in the sagittal plane with a medial lateral axis. Radial deviation and ulnar deviation, which is the moving left and right, takes place in the frontal plane on the sagittal axis.